All right, good afternoon. This is Gary McLeod returning with another update. Today is March 31st, the last day of March. I hope you're all doing well. You're doing a remarkable job of taking care of your patients during this pretty much uncertain time. And I'm just hoping that these updates will provide a little certainty in some very specific areas of decisions that you face every day. Let's first talk about testing. So you might have received already an email which had attached the newest testing criteria for our COVID patients. We've relaxed the criteria now to include all symptomatic patients. And along with that, we've included a broader description of what the symptoms are that we're looking for, because we are learning now from data that there's a myriad of differing symptoms that patients present with. We've relaxed our criteria at the request of our public health officer here in Sonoma County, as she is looking for more testing to get better surveillance data on our community. And given that we have a very functional respiratory clinic and have adequate supplies at this time, we have complied with her request. We are operating a respiratory clinic now 7 days a week. During the week, we're seeing about 60 patients a day. We are aware that this will increase our throughput, and we'll let you know if that does not go well, if we have to make any changes. We've also established a new workflow for our providers where you to need some testing. This came out as a staff message in Epic, I believe, yesterday. That is to say, if you become symptomatic, you should not be working. The protocol is such that you should call Dr. Valenzuela, our CMO. He will provide you with a testing code and refer you to our respiratory clinic where you will be tested. For the providers, our specimens are being sent to the Sutter Shared Lab, where we will receive prioritized testing, and they're assuring us that the turnaround should be under 24 hours for us specifically. We've mentioned temperature screening, and we're getting near to the day when we can institute this throughout. We're piloting it now. What I'm referring to is checking the temperature of all providers and staff as they enter the care center. A symptomatic individual is one who has a temperature of 100 or over, and then you would then follow the protocol I just mentioned by reaching Peter. In terms of our production, I really applaud everyone for being energetic and adventurous and diving into video visits through all the different modalities that we have now. And at this time, there are a number of people using different modalities that works for them in different clinics. At the same time, we're rolling out the Sutter Preferred method, which is using Canto on iPads, and we're all in the process of getting trained. We're in the midst of that. I do ask that you have patience and gratitude for those individuals who are working day and night to effectively train 5,000 providers in the course of just several weeks. And among those are your peers in your office, your PSRs, and your MAs, because they also are learning entirely new workflows and standard work that have been designed just for them. So I would ask that you partner with them and be patient with them and actually team up with them to perfect this process, because no doubt video clinics will be the ones that we'll be using for a long time. And today we're also sending out information about a new virtual test, that is e-consults, and by that I mean the ability for PCPs to request a consultation virtually from a consultant. This is something we discovered by Dr. Coley, who brought this to our attention. And so I will be sending out an attachment with my Outlook message, which gives you some of the specifics that are required, in addition to some really down and dirty, how do you perform this consultation, which is written by Dr. McLeod. And I think we'll be using this a lot. So finally, we've entered into our third week now of trimming our schedules back as our part in following the shelter-in-place orders for our community. I know it's been difficult for everybody, but we ask that you continue in this format. I really would suggest that you sit down with your MA and start scrubbing your schedule 2 or 3 days in advance, and that you try to identify patients which you can convert to telephone or video visits, or ones that really need to come in person, or those that could be postponed. And again, we're using the same criteria as always, that is, those elective individuals who could wait a couple of weeks, we want to put them off some more. Last thing I do want to say around that is that currently the stance is that Medicare annual wellness visits we cannot perform on a virtual basis. So again, thanks to all of you for your hard work. You just need to know you're on a daily basis you're performing very meaningful work that's supporting your community. And I do want you to take good care of yourself, your peers, and your family. Thank you.